Hi guys, today we're here to talk about Charles Bonnet syndrome. I'm Nini.
I'm Alex.
And I'm Bea.
So, what is Charles Bonnet syndrome? It was obviously named after Charles Bonnet, who was a Swiss philosopher. It causes people who've lost their vision to have visual hallucinations, which are the symptoms, and they're very vivid, usually of faces or cartoons. And there are two types. First one is simple repeated patterns, which is of usually consists of grids, shapes, and lines. And then the second one is complex hallucinations, which include people, objects, or landscapes. And usually those people, they're aware that the visions aren't real. And first, Charles Bonnet, he observed it in his 87-year-old grandfather who lost his vision from his cataracts, but he said that he still saw men, women, birds, carriages, buildings, scaffoldings, and tapestries. And in 1760, he documented a range of complex visual hallucinations that occurred in seemingly psychological normal people.
So, in terms of neurological explanation, this syndrome actually really occurs in psychologically normal people. The only problems that they stumble upon is because of their vision loss. So they tend to have cataracts or glaucoma or macular degeneration. And in very rare cases of this syndrome, it might be associated with a brain tumor. And so, actually, a woman who had a brain tumor experienced these hallucinations, and that was due to compression of the optic nerves at the optic chiasm. And so, the hallucination soon vanished after a resection during surgery. However, these complex visual hallucinations come from stimulation of the visual cortex, and it's pretty much the brain trying to make up for missing pieces in vision. So, in prevalence, it affects both young and old people. However, as Alex will later talk about, a lot of the case studies we saw were old people. Um, More than 100,000 people with Charles Bonnet have been found in the UK, and it occurs in as many as a third of visually impaired people. And up to half of all people with macular degeneration have this, or tend to have this.
So here's a little video just detailing an experience of living with Charles Bonnet syndrome. And I think one thing to keep an eye out during this video is how normal and fine the person with Charles Bonnet syndrome is.
My blue vision started about 5 years ago. In my right eye, I would not be able to see things very well. And I was able to drive, but reading was difficult. I kept saying to my husband, the print is getting lighter and lighter in the newspaper. What are they doing, you know? But, and that's where I noticed it more, in reading. But as far as seeing around the house, that was pretty good, and I could drive. The first time I ever noticed the Charles Bonnet syndrome was looking out over the water here at the trees across the canal, and they were all covered with lovely pink flowers from head to bottom. And I mentioned it to my husband, and he said, there are no flowers over there, Joan. But that would happen quite frequently. The way I reacted to it was that I just thought it was strange, and I thought maybe it had something to do with my vision. I really wasn't concerned about it as being a mental problem or anything. I just thought it was the way I was seeing. It happened various times of the day. I noticed it more in the mornings when I would be sitting at the kitchen table and looking out at the trees and things. I would see the flowers. But it could also happen in the afternoon, or someone's clothes might be a print that I knew they weren't a print. I mentioned it to two doctors, and neither one of them knew what it was. So I was very relieved when I went to the low vision doctor, Moak, and she was familiar with it. Things that have helped me since I've had low vision uh, was that the therapist came out and put some little dots on my washing machine and dryer and on my stove so that I could see what buttons I wanted to push. I also have been getting um, large print books from the National Library of Congress that has a program for the disabled and visually impaired people that sends you books and tapes. I've been getting those and enjoying them very much.
As you can see, there was nothing wrong psychologically with the old lady. It was rather that her vision deteriorated. She seemed perfectly normal, perfectly happy in her own life, but she did suffer a bit of hallucinations. So we studied some other case studies. One example is that there was a healthy 85-year-old woman who went into a hospital, and she was complaining about suffering hallucinations for an entire week, and she was quite frightened about it. So the first thing the doctors did is that they looked at her previous medical history to see if there were any previous episodes of hallucinations or other psychological disorders. They found nothing. But what they did find is that this 85-year-old woman, she had cataracts, she had glaucoma, she had multiple eye surgeries. And again, we're just emphasizing that point that, there's nothing wrong with you psychologically, it's just that your eyesight's going. And the other two case studies we studied, it was more about how these hallucinations took place. So in instance with a 95-year-old woman with macular degeneration, she said that her hallucinations were come in the evening, and that's when the visitors were coming when she was watching the news. And her quote she said is, "Now I just sit back and watch the show. Having Charles Bonnet syndrome is like seeing a little movie, though it's quite strange." And as we'll get into later, being able to normalize these experiences is a key to understanding living a healthy life. So the other case study was with a patient having visual hallucinations of small children popping up in her vision. This patient knew that she was having small children. She didn't try to speak or interact with them in any way, and they never spoke to her. She didn't recognize them. She knew the key point is that she knew these hallucinations weren't real, and she wasn't frightened of them, but they were there.
So when it comes to treatment and management, there really isn't a cure, unfortunately, but you can reframe Charles Bonnet syndrome from a problem into an experience. And this experience should try to be normalized. The patients should be encouraged to talk about their visions. The hallucinations shouldn't be psychoanalyzed. And eye exercises, they can potentially stop a hallucination, which is a benefit.
And one important thing to note is that these patients, they're not scared of their visions, and so they know that they are happening, but they are sometimes scared that others might look at them weird if they speak about it. And that's why we kept saying that it should be normalized and it should be seen as an experience rather than a problem. Okay, here are references. Thank you for watching.
Enjoy your day off of class. Don't get drunk.